Hi, this is Dr. Nick. I'm the Incrementalist. I'm here with Healthcare Now Radio, and I'm here with Katie Keating. She is from IBM Watson Health, and she's a Client Solutions Executive.
Hi.
Katie, thanks for joining me. So we're at the Connected Health Symposium here in the Rayburn building in Washington, D.C. What are you guys showing? What are you talking about?
Sure, we're here to talk about how Watson Health is working to help improve outcomes for citizens in the communities. So Watson Health has a lot of technology. We're using AI to help map, uncover cancer in images. We're getting people connected to clinical trials, but we're also looking at how we can coordinate care amongst care teams to get better outcomes for citizens.
So I was one of the people that watched the original
Jeopardy.
Okay. You know, so what's the leap? What's happened since then? That was a while ago.
Yeah.
What's the new innovation and what's happening in healthcare that's really unique and different from IBM Watson Health?
Sure. So Watson for Jeopardy, started off trained to do something very specific,
right.
And now we've taken that technology and those learnings and extrapolated it out to a huge bunch of different ways to use that same sort of learning mechanism to uncover things in data, to help get patients connected to services they need, and to get people connected in their community as well.
So can you give us a specific example of that?
Sure. So our video behind us is talking about Sonoma County. Unfortunately, they've had wildfires in the past year and 2 years ago.
Right.
And what they did is they really took a holistic, person-centered approach. They have 13 safety net departments, and instead of having individuals move from one to the next sort of as their issues get taken care of, they started working together to share information. But they didn't have any technology that allowed them to do that. They worked in really siloed systems that were tied to agencies or funding streams, but that wasn't letting them really work together in the way they needed to. So we leveraged our technology so that they now have a platform they can share information on, they pull in information from other systems, and they can really look at the person holistically. So they know if they missed an appointment, why it was. Different members of the organization can get involved as it's appropriate, and they're getting fantastic results.
So now when somebody misses an appointment, you've actually got some insight as to the reason. So as opposed to just calling them up and saying, you missed an appointment, you're actually problem solving and giving them solutions?
Absolutely. And one of the things we find in healthcare is that oftentimes people are given a piece of paper for a referral. They're told to sort of walk out the door. Paper. And really, they have to do a lot of self-service. So, providers don't know if they use that referral, if it was successful, what that intervention was like. And especially when we're talking about vulnerable populations. So you learn you have diabetes, and one of your big problems is you don't have nutritious food. Just sending someone out to the door isn't going to help, but you can get them a referral to a food bank. You can let the food bank know they're coming. Then you can start to understand if they showed up. If they're feeding their kids, if they're improving their own diet, and then you can really start to see that effect on health as well.
And importantly, if you give the food bank information about the fact that they're diabetic, they can actually be thoughtful in the way that they try and help those
Absolutely, yeah.
Wow, radical thought here. Isn't that crazy? So what's next for IBM Watson Health? What's coming?
Oh, there's all sorts of stuff. That's a hard question because I have sort of the areas of my interest and then what's going on globally. I think really what we're looking for is expanding where we've been successful. So with our cancer work, we started with a subset of cancers that we were really targeting, and now that sort of learning's been done, we're expanding those every year. And sort of the learning is you can take all the learning you had before, and we're able to add on to it more rapidly. In my area, we're looking at what our customers really want to know is how do I feel confident that I'm making the best decision for the person in front of me? And that's really what we want to get to. We're not there yet. We've got some great predictive work going on and with our data and our algorithms, and we've got some AI around that. But that's what people really want to know. They want to feel confident that what they're going to do is going to have a positive impact for people.
Right information, right place, right time, gets the right kind of care.
Absolutely.
All right, so thank you very much,
Thank
Katie.
you, Dr.
It's been a pleasure.
It's been great.
Thanks for joining me.
Absolutely.
I'm Dr. Nick. I'm the Incrementalist. I'm here with Healthcare Now Radio, and I'm reporting from the Connected Health Initiative from the Rayburn building in Washington, D.C.